Well, welcome to this video demonstration where we're just going to talk you through what faint lines on a drug test mean and the implications for those in terms of how you read your results, but also why they occur and why there's variance between the different tests on particularly multi-panel saliva drug tests where you've got a single membrane with multiple tests embedded into it, but also on the single test membranes in the peripheral type devices. So we're going to show you these two saliva tests that have been run now. One's got solutions that have been put through controls for positive tests on some membranes, and the other is completely negative, and we're just going to see if we can bring those forward to camera and show you some variation. The first one we're going to show you is this DSD 863. This one's got a saliva indicator in, so the first little bit to show you here is this modern design window, which starts off yellow when you get it out of the packet and turns to this sort of bluey turquoise colour when adequate saliva has been run through the test. And we're just going to try and focus the camera in on these test results here. You'll see on this particular design you've got two parallel runs of test results with a control line at the far end, and you'll see along these different tests quite a variation in the colour density, thickness and saturation of the test lines. These are all negative results for all 6 drug groups. They're abbreviated to the MET, BZO, THC on the right hand column, and OPI, cocaine, and amphetamine. OPI is the opiate test membrane. But why do you get this variation in the colour density? You'll see the control lines, there's a little variation in the two colour densities between the two sides, but the THC line is extremely faint. Now the reason for this is these are all individually embedded membranes that have the antigenic material embedded into the membrane, and these are built up in a strip, if you like, along a long flat piece of membrane which is then cut into these strips. But the difference in this is that the THC membrane there is screening for 12 nanograms of THC, which is a very different dynamic test antigenic material to the BZO and MET above, which are screening at higher levels. So there is always going to be this variation between the THC and the BZO and the MET and any other membrane on there, and that is going to be more or less consistent across a series of tests that you do with this. You will notice, even if you were to do a couple of successive tests with this particular membrane, there may be some variation between samples that were just collected a couple of minutes apart. But you always have to interpret these in terms of, is there a line or isn't there a line at that test loan at the development time of 5 to 10 minutes, and your result has to be read as the negative or positive. You should not try to interpret or draw any conclusions from a very thin or faint line, because there will normally be these variations. Now what we're going to move to now is this comparative test, which is made by the same manufacturer, contains the same combination more or less of membranes, and you'll see here that there's quite a bit of variation, and some lines are extremely thin and faint. So the oxycodone test membrane here, very faint line in presence of a control line. The OPI, a very faint line, test line there with a control line. There is no test line showing on the amphetamine indicating a positive result. There is no test line showing on the methadone indicating a positive result. The BZO line again is present but faint. The COC line next to that is thin and faint but present. The K2 membrane line, test line, is thin and faint, so that's a negative result. There is no MET line showing in the presence of a control line, so that is positive for methamphetamine. And again, PCP, negative, positive for THC. Presence of a very thin control line, but that is a clear positive result. And again for buprenorphine, control line, much darker than the THC control line you'll see, but you will get these variances. They're absolutely normal. No test line, so that's a positive, and on this particular test you've also got the alcohol test there. So you will see that there is naturally a great variation in the test line density, colour saturation, and that is an entirely normal feature of not just saliva tests but also urine tests. It does tend to be more pronounced on some of these supersensitive saliva membranes compared to their urine equivalents, and that's simply down to the low nanograms per mil concentration that you're expecting these tests and the manufacturers set them to work at, the very nature almost dictates that the test line is going to change and be, in some instances, quite thin and faint. In that situation, you've got to give it the full development time. If it says read at 5 to 10 minutes, you give it a full 10 minutes before you interpret that positive test result. So there we go. I hope you have learned a little thing along the way about the interpretation and the reason why you get this variation in the line density on saliva drug testing kits.